Today, we're diving into the brutal, chaotic, and surprisingly innovative world of medicine during the First World War. It was a conflict that caused injuries on a scale nobody had ever seen before. But out of that chaos, out of sheer necessity, came some incredible medical breakthroughs that, honestly, still save our lives today.
So I want you to just imagine this for a second. You're in a trench. The noise is deafening. You're covered in cold mud and you're terrified. And then you're hit. Right there, your fight for survival has only just begun. It's a race against time, against infection, against the very limits of what medicine could do. So what was that desperate journey actually like?
To really get a handle on the medicine, you first have to understand the battlefield. And the trenches of the Western Front, well, they were one of the most hostile places you can possibly imagine. Not just because of the enemy, but because of the conditions themselves.
You see, the trench system was this marvel of brutal engineering. You had your frontline trenches, and they were built in that famous zigzag shape. Now that wasn't random, it was actually a life-saving design. It was meant to contain the blast from an exploding shell and stop an enemy from being able to fire straight down the line. Then behind those, you had support and reserve trenches, all connected by these communication trenches and protected by tons of barbed wire.
But actually living in them, it was a nightmare. The trenches were almost always flooded, which turned the ground into this thick, sticky, inescapable mud. They were incredibly crowded, and sanitation was, well, it was pretty much non-existent. This created the perfect breeding ground for lice, rats, and all kinds of deadly diseases. Any wound, even a tiny cut, was at immediate risk of a massive, life-threatening infection.
The environment itself was just a relentless enemy. Take trench foot, for example. It was this horrifying fungal infection caused simply by having cold, wet feet for days and days on end. A soldier's feet would go numb and swell up, and then the tissue would literally begin to die and rot away. If gangrene set in, amputation was the only option.
And as if all that wasn't bad enough, 1915 brought a terrifying new chapter in warfare. At the Second Battle of Ypres, Germany unleashed a weapon that didn't attack with bullets or shells, but with the very air the soldiers had to breathe.
Poison gas was just devastating. Chlorine gas would destroy your lungs from the inside out, causing men to literally drown in their own fluids. Mustard gas caused these awful chemical burns, both on the skin and in the eyes. The only defense was the quick invention and rollout of gas masks, a grim new piece of every soldier's kit.
So, with all these threats, what actually happened when a soldier got wounded? Well, an incredibly dangerous and complicated evacuation system would kick into gear. It was a desperate race to get from the mud of the battlefield to a doctor's care.
The very first link in this chain of survival was the stretcher bearer. Now, these weren't specialized medics, they were just ordinary soldiers. They had the heroic and unbelievably dangerous job of running into no man's land, under fire, to try and get the wounded. It could take hours, sometimes even days to reach a fallen comrade, and for so many, that delay was a death sentence.
So once you were off the battlefield, the next challenge was transport. Motorized ambulances were a huge step up from the old, slow, horse-drawn carts for sure, but they still had a tough time. The roads were often just muddy tracks, riddled with shell craters. That meant a journey that should have taken a few minutes could stretch into agonizing hours. The whole medical effort for the British forces was organized by the Royal Army Medical Corps, or the RAMC. These were the doctors, the nurses, the orderlies, all the people who staffed every single stage of that evacuation chain, working tirelessly in just unbelievable conditions to save lives.
And they weren't alone. The First Aid Nursing Yeomanry, or FANY, was this incredible organization of women volunteers. Starting in 1916, they drove ambulances, they ran mobile kitchens, they treated the wounded, and they often did it dangerously close to the front lines. It was a role that really defied all the conventions of the time.
This whole process was known as the chain of evacuation. It was a very structured pathway designed to get a soldier away from the front line and move them through facilities with more and more advanced medical care.
So a wounded soldier would pass through three main stages. First, they'd hit the dressing station, then the casualty clearing station, and finally, if they made it that far, a base hospital. Each step was like a filter, providing a higher and higher level of care as the soldier got further from the fighting.
So, the first stop was the dressing station. This was often just a post set up in a hurry, in a dugout or a ruined building, right behind the front line. The goal here was frantic but simple. Stop the bleeding, clean the wound as best you could in all that chaos, slap on a bandage, and get that soldier moving to the next stage.
The next and really crucial stop was the Casualty Clearing Station, the CCS. These were located a few miles back from the front, and they were basically the first real hospitals a soldier would see. This is where the life or death decisions were made. Doctors performed emergency surgeries, amputations, treating terrible chest wounds, anything to stabilize a patient enough for the long journey that was still ahead of them.
The final destination in this chain was the base hospital. These were large, well-equipped facilities way far away from the front lines, often near the coast or back in England, like Queen Mary's Hospital. Here, specialist surgeons could do really complex operations, and soldiers could finally begin the long, slow process of treatment and recovery.
And sometimes they had to get incredibly creative just to find a safe place to heal. Near Arras, they built an entire hospital underground in these ancient chalk tunnels. It was a subterranean sanctuary, complete with wards and operating theaters that could hold hundreds of patients, all of it designed to protect doctors and their patients from the constant threat of artillery.
Now here's the amazing part. All of this immense pressure, this constant flood of casualties with new and terrible injuries, it forced medicine to evolve at an incredible speed. The war basically became an incubator for breakthroughs that would change healthcare forever. Okay, take the Thomas splint. Before the war, if a soldier broke their femur, their thigh bone, they only had about a 20% chance of survival. The broken bone would move around, severing arteries and causing massive internal bleeding and shock. This simple device, which just held the leg still for transport, was absolutely revolutionary. It raised the survival rate for that injury to over 80%. Just incredible.
But maybe the most dramatic leap forward was in the fight against severe bleeding. I mean, the impact here is just staggering. Before 1917, a soldier's chance of surviving massive blood loss was basically zero. After they introduced blood transfusions, that number jumped to 55%. It was nothing short of a medical miracle.
The big breakthrough came from a pretty simple discovery. Adding sodium citrate to blood stops it from clotting. That meant it could be stored. This led to the creation of the world's very first blood bank at the Battle of Cambrai in 1917, where they kept donated blood viable in containers packed with ice and sawdust. You combine that with better methods for matching blood types, and this one innovation saved countless lives.
And the innovation just kept on coming. Surgeons like Harold Gillies pioneered early plastic surgery, using new skin grafting techniques to literally rebuild the faces of soldiers with these horrific shrapnel wounds. At the same time, in brain surgery, a doctor named Harvey Cushing developed this amazing technique using a magnet to gently pull metal fragments out of the brain, which dramatically improved a patient's chance of survival.
So when you look at it all, from organized trauma care to blood banks and advanced surgery, the terrible crucible of the Great War forced what feels like a century of medical progress into just 4 short years. Which leaves us with a pretty powerful question, right? How much of the emergency medicine that saves lives in our own hospitals today was actually forged in the mud and blood of the trenches?